So passing CPEN. People ask whether it's on a live class or via email, simply what do I need to do to pass CPEN? And it's a very valid question, especially since remember that the test is a couple $100. Meaning if you're going to spend that many hundreds of dollars to go ahead and take the test, you understandably would want to maximize your chance of passing it the first time. So with that, a couple things come into play, the first of which is experience. If you look at the BCEN website, which is, remember, who goes ahead and administers the CPEN exam, what they recommend is 2 years of experience. Now, this doesn't have to be 2 years at a dedicated, we see absolutely nothing but children ER, but it's a certified pediatric emergency nurse exam. So therefore, they'd like you to have at least some sort of experience when it comes to taking care of sick and not sick children. So according to the people who administer the test, they recommend that before you sit for the exam that you have at least 2 years of clinical experience. Now, when it comes to other things that are going to maximize your chance of passing the test, a couple recommendations I have, first of which you need to get a hold of and beg, borrow, steal, emphasis on get one, a copy of an ENPC textbook. This is crucial. The rationale is that a fair amount of people who wrote the ENPC textbook were also item writers for the CPEN exam. And there's boatloads of stuff that literally looks like they cut and pasted it from one directly onto the other. Number two, before you sit for the exam, beg, borrow, steal, get a hold of a current copy of PALS, and just flip through that. And lastly, when it comes to review books, just simply find one that works for you. As we'll show you, there's several CPEN review books currently out there. And of them, of the 4 that are out there, I recommend 2 of them. The first of which, as you can imagine, is mine. Now, I'm biased because years ago when CPEN first came out, I wrote the very first CPEN review book. And this is now the 3rd edition. And the 3rd edition has over 1,000 questions. More importantly is each of the questions also has 1 to 2 paragraph rationales. And it's not written like a textbook. That's not the way my brain works. Having been certified in lots of things over the years, if I sit down with a textbook, it's boring. Within 15 minutes, I'm ready to fall asleep. When you read through my particular book, it's written like you and I are sitting down having a couple margaritas, and we're talking sick kids. And with that in mind, again, it's 1,000 plus questions, and the rationales are there to show you why this is or is not the correct answer. Just like when it comes to the actual exam, it's broken up by body systems, anything from neuro to cardiac to respiratory, etc. But with that, again, you've got over 1,000 questions in a very easy format. And since everybody learns differently, some people can sit down and just read a book and immediately get it. Other people are more of an audio reader focus, meaning that they do much better when they don't necessarily sit and stare at it, but they listen to it, especially if you commute to work. That's where I do personally a lot of my listening is simply I get smart when I drive to work because I've got an hour there and an hour back that I can listen to podcasts, etc. And if you find that you do better in an audio format, we've taken the 3rd edition of the book and we've read it. So that way, if you read that way, you go ahead and you can learn and listen and get over 1,000 questions while you're driving to work back and forth. Now, other things that are out there that I recommend is the ENA's textbook. Now, it's a really good book. I mean, there's nothing else to say. Obviously, I'm biased towards mine, but honestly, this is a really good book. And if you're going to take the exam, if your finances allow, I honestly would recommend, if your buddy doesn't have one, that you ought to purchase one. And the rationale is, number 1, it's written by ENA, the people who originally invented the test itself. Number 2, more importantly, is the questions that are in the book are written in the exact way that you're going to see them on the test. Meaning, when you take a look at my book, the questions are there, and they're there only so that it gives you some rationale so that you read the rationale. That's why I have questions. It's just so you can read the rationale and get an idea as to whatever we happen to be talking about. Their questions are written by the people who wrote the test. And they are written in a very much, for lack of a better term, not so exciting format. But if you're looking for a review that the information is really good, but it's actually written in the formal way that you're going to see test questions, that's absolutely a really good recommendation when it comes to books. Now, there's two other CPEN books out there. The first of which is entitled Practice Questions for Certified Pediatric Emergency Nursing, or CPEN Review. And that's by a company called Nurse Builders. And there's another one out there that's called CPEN Exam Secrets, which is by a company called Pedi-Ed-Trics. And either way, when you look at these, not only based on the fact that you could fit 4 of these into one of our books, but more importantly, yes, they're out there. But honestly, I don't recommend it. My rationale is not because of competition, right? Because again, I absolutely hands down recommend ENA's book. It's really good. But my idea when I take a look at any review book is simple, and that's called, number 1, did I learn something? And number 2, more importantly, if I read this book, do I feel like I could sit down the next day and pass the test? And that's my gauge to figure out whether it's actually something that's going to be useful. And regrettably, when I looked at both of those books, unquestionably, I did not feel that I could sit down and pass the test based on reading those 2 books. Now, you may have different feelings if you take a look at them, but again, from my perspective, I just don't feel, regrettably, that you would be able to pass the test based on those books. So, number 1, again, you got to have a little bit of experience because books are nice, but taking care of patients is better. Number 2, get a hold of 1 or 2, if you've got the resources, CPEN review books. 1 you'll enjoy, 1 that you'll see how the test is actually written. Number 3 is, if you have the ability, go to some sort of review course. There's several people out there who offer live CPEN review courses. Of course, I offer them live as well. And when you take a look at the live courses, again, what it does is it takes what's in the book. And more importantly, in the presence of your instructor, you just go back and forth over lots of information throughout the day. And if you like live, that's wonderful. Or if you're a person who doesn't have the ability to get away to go to a live course, or if you find you learn better sitting at your computer or on your couch, that's okay too. Because we offer the live class available online. And it's exactly the same class that you're going to see live because we videotaped it in the back of the room at a live class. It's the same class with the bad jokes and even worse videos. And yes, you get CEU credits just like you would if you were going to go ahead and attend a live class. But either way, if you're going to take CPEN, I highly recommend you review those various materials. Now, lastly, the question people ask, and it's a really valid question, and we get this routinely from people who are going to book one of our seminars, is they ask, what is your pass rate? And that's a really valid question. However, I asked another fellow educator this same question, and he came up with a really nice reply, which I saved on my computer. And that way, whenever anybody emails us asking us this question, I just simply forward it because it was really eloquently written. And I'm not going to do it justice, but the moral of the story is what he said is this. There's several companies out there that will tell you that they have a 100% pass rate for an exam. He's like, that's not real. And his rationale, which I really liked, was he said, you know what, if you're going to say you have a 100% pass rate, he said that means that every single person who goes to the class, that the company who's offering the review class has to be able to monitor them to make sure that not only that every single person who took the class actually took the test. Because a fair amount of people take our review classes and they're not interested in taking the test at all. They're just looking for a fast, fun review of all things sick kids. But he's like, number 1, you got to make sure that everybody who actually takes the class actually takes the test. And then number 2 is every single person who takes the test, you have to have verification from the company that administered the test saying yes, that they actually passed the test. So with that, unless you actually have that ability to know that every person who went actually took it, and every single person who went took it and from the company actually was verified as passing it, it's really not feasible to say that you have a 100% pass rate. So with that, people ask, what's your pass rate? And honestly, I can say, I don't know. But that's being honest. What I can tell you, though, is at least a couple times a week that we get emails from people who say either A, they read the book, or B, they read the book and they went to either our online or our live crash CPEN review course and they passed the test. So again, nobody can tell you, in my honest opinion, with 100% certainty, you're going to pass. I mean, that's just not real. But again, every single week we get several emails saying, you know what, I'm so happy I passed. So if you want to pass CPEN, have a little bit of experience, meaning at least a couple years, you're dealing with sick kids, they deserve nothing less. Number two, if you're going to spend a couple $100s on the test, take the time to prepare for it. Meaning, get a review book, look over ENPC, look over PALS. And if you have the capabilities, take an online or a live review course just to clue you in as to you're really good at this, or you need to go ahead and probably brush up on this. And past experiences have shown that if indeed you're able to do those various things, that across the board you have an unbelievably good chance at happily passing the CPEN exam. Good luck.